Welcome back, everyone. Tammie Colon with us today from Mental Health Recovery Services. We're talking about naloxone and the use of that, and we've done stories on that, Tammie, over the past few years, and it seems like it's getting more readily available, whether it's through EMS units or even at schools and those kind of things. Do you get the sense that there's more access if somebody does have an emergency?
Yeah, I think that we've been blessed in our communities that most of our first responders, our hospitals, and our professionals are equipped to manage an overdose. Our plea most recently, Jeff, has been trying to educate the community that it's free to them as well, that it's available in multiple locations. If you have a family member, a friend, a neighbor, or if you're an establishment and you're concerned that someone may come in and have overdosed and then come in or overdose in your establishment, that the naloxone, the Narcan, it's available, it's free, it's easy to administer, and we'd like to equip as many people as we can.
I remember the debate that I feel like it has died down because we're talking about people who have addiction and sometimes get to that crisis point. And I remember the debate used to be, well, if we pull access of Narcan away from them, then they won't use drugs. And I think we've finally kind of dispelled that myth, haven't we?
Not as much as we'd like. I think it's a conversation similar to other social situations that we have in our community these days, that there are some people who are still on the side that we're enabling, that it generates Narcan parties, that we should not make it as readily available as it allows people to use more. None of that has any evidence behind it. It's all very subjective, but I think we're moving in the right direction. But it really needs more attention, more education. Our community needs to be more aware that having and administering Narcan is not going to increase the substance use that's going on in our communities.
One of those areas, and you mentioned it, is the use of fentanyl, and it feels like we're seeing an increased amount of that. And you were talking about, too, we're seeing overdoses on that as well, right?
Yeah, so, we are, the highest year for overdoses was 2017, and we have passed that already in 2021. And so we know that more people are using, but we also know that more people are suffering in greater intensity due to the use of fentanyl, that the substances that they're buying are being laced with fentanyl, which has a higher dose of opioid in it, which is causing overdoses and causing greater addiction. But I also don't want to forget that, we started this crisis also with people who were prescribed medication. They did not intentionally go down this road. They are on it, and we want to keep them alive and safe until we can get them well and treated.
It's such a good point because, as you mentioned, a lot of times that prescription medication, which could come after a surgery, after an injury, for pain tolerance and those kind of things, has often led to opioid addiction. It's kind of the changing face in some cases of addiction. It's the people that go to work every day and we see every day. It's not typically what we're used to thinking of, is it?
It isn't. It really never has been. That's just what we had in our head. And that's because it's easy for us then to just sort of dismiss that population in our community, unfortunately. But it really is affecting every family. It's coming in every size, shape, color. And nobody should not receive the care and treatment they need to stay alive and also to have the opportunity to get into treatment. But I also encourage people around this time of the holidays, when we have lots of people in and out of our homes, if there are any opioids in the house, everybody is at risk. So if a young person happens to pick up a pill that's dropped or gets, starts to explore, they also can be overdosing accidentally. And having the equipment in your home to keep everybody safe is responsible.
Yeah, and as you said, it doesn't take long to get all those safety precautions in place. Tammie, thank you so much for the advice. We appreciate it.
You're welcome. Thank you.
Nice talking with you. We'll be back, right?